everyone, and welcome to today's Brace Bites. And the frequently asked question for today is, which brace is best for my child? And of course, this is a difficult question. As parents, we always worry about what the best thing is to do for our children. And I think what we have to remember is that when we think about children's treatment and we think about adult treatment, it's the difference in the lifestyles that children and adults live. And so, of course, as a parent and also as a child, when you are wearing a brace, you're thinking about going to school. You're thinking about how you're going to clean that brace. You're thinking about how you're going to be eating when you're at school and having your lunches. And so these are the sorts of things that people want to take into consideration when they're choosing a brace type. Now, many of you as parents will remember this kind of plastic kind of pallet brace, as people call them, that we do sometimes still occasionally use, but they're very rarely the only treatment of choice. Sometimes they're a little bit kind of along the way to get to where we want to be. And of course, you'll be very, very familiar with these sorts of train trap braces, as we call them, because these are the ones that are very commonly available on the NHS. And so you see many, many children that are wearing these braces. And I suppose the thing that you need to be aware of is that if you were on the NHS, this would pretty much be your only choice of brace. Whereas when you are choosing private options, you can go ahead and choose a little bit more of a cosmetic version of the same brace. So this is what we call a ceramic brace, which is still a fixed brace as well. Or what is becoming more and more popular these days, what we call aligners, which are little clear plastic, looks like a mouth guard. We call them aligners, and they basically push your teeth into position. So what are the main differences between a fixed brace and an aligner brace? So when you're thinking about aligners, they are a little bit more comfortable to wear because you haven't got any little wires or any of the brackets that are rubbing on your teeth or poking out or anything like that. And you are less likely to have breakages. So sometimes this is a big factor for parents because obviously it's very difficult to take the children out of school for appointments. The other nice thing about these aligners is that they are not only more comfortable to wear, but people like to wear them if your child is very sporty or if they play musical instruments, obviously wind instruments especially, because you can take these braces out and then they don't interrupt with your day-to-day lifestyle and the hobbies that you might have. So that's what makes these really, really popular. Now, the biggest problem for these is parents worry that their children won't wear them. So you take this out at lunchtime to eat your meal and your child never quite gets round to putting it back in the mouth and actually just lives in their pocket for the rest of the day. And this is understandably a worry because if you are going to invest in the time and effort that it takes to have nice straight teeth, you want to get to a nice result. And so often that's what makes people pick a fixed type brace, either the metal brace or the ceramic brace, because parents think, well, that's much easier. It's glued onto my child's teeth. I know that it will be doing its job. But I think the thing that you do also need to remember about this is that it's much more difficult to keep this brace clean. And one of the biggest risks of fixed brace treatment is that unless you're keeping all of these little squares nice and clean, if you're getting food stagnating around them at all, or if you're not cleaning them properly or not maintaining a good diet, then when you take this little square off your teeth at the end of the treatment, you sometimes have a little square imprint in there. And that's what we call demineralization, or white spot lesions, they are sometimes known as, and they are permanent marks on the teeth that cannot be removed after the treatment. They are avoidable. They are completely avoidable with good brushing, good hygiene and a good diet, but the risk is that your child is not maintaining those, and therefore you'll get to the end of the treatment and you have these lovely straight teeth, but you haven't got the nice health of the teeth that they were there before, and there sometimes is some damage to them. So I think it's really important to be aware that despite whichever brace you choose, you do still need to wear a retainer. So this looks a little bit like those aligners that I showed you earlier, but it's a little bit more robust, a little less flexible, and you're going to be wearing these pretty much for the rest of forever, maybe just at night times only, every other night, a couple of nights a week, but you do need to wear a retainer of some sort in order to keep your teeth nice and straight. Now, sometimes people have what we call a fixed retainer, which which is a little wire. You can just see the glue dots on there, but it's a little wire that's glued onto the inside of the teeth. And then you have the removable retainer that goes over the top of them. But whichever brace your child wears, even when you get a lovely result at the end of the treatment, it's not going to stay looking straight unless you're wearing the retainer. So I think those are the really, really important things to be aware of. Personally, I feel that actually if you choose a brace, it doesn't really matter which brace you choose. I always say to people, you need to choose a brace that suits your lifestyle. So only you know your child, you know how compliant they might be with something like this versus how well they're going to brush their teeth with something like this. The outcome of the treatment is dependent upon your orthodontist, and so it is our job to get you the great outcome. It is simply your job to wear your brace and wear your brace well, making sure you're keeping your teeth nice and clean, making sure that you're doing what you need to do and putting your brace back in your mouth again. And then of course you need to make sure that you're wearing your retainer. So I think the things that you need to think about is, one, you don't need to worry about the outcome. That's our job. We worry about that for you. You simply need to make sure you're keeping your teeth nice and clean. You're doing all the things that your orthodontist has asked you to do in order to get that great outcome. And that when you've got that great outcome, you're wearing your retainer at the end of it so that you can maintain that smile and keep that beautiful smile for life. So I hope that's really helped you this evening to help you make some decisions. Of course, if you need any more information, you know where we are. And have a great evening. Take care. Bye-bye.